advanced technologies in spine. Spine surgery over last 2 decades have evolved enormously. And rightly so, because spine is one delicate organ. It's a complex plexus of nerves, and any little damage to these nerves can lead to disastrous complications. So that's the reason technology and spine treatment, they go hand in hand. Along with the experienced surgeon, advanced technology is equally important. So when I talk of this advanced technology, what are these advanced technology? First is robotics, which helps surgeon inside the operation theater to get a desirable result, what he expects to, without causing damage to the normal tissues of the body. It is precise, accurate, minimally invasive, smaller incisions, less blood loss, and faster recovery. Second is O-arm. O-arm is an intraoperative scanner which is available inside the operation theater that guides us into complex revision spine surgeries, complex spinal deformities, tumors, fractures, and cervical spine surgeries. After the surgery, we take a O-arm spin and make sure that the surgery is gone off well and patient is all set for achieve desirable result. Third is neuronavigation. So neuronavigation is if I have to travel from Pune to Nasik, how do I do that? I put the destination on my navigation and I reach there automatically. Similarly in spine, the diseased area, initially there used to be long cut to reach that diseased area. But in today's era, with navigation, without cutting the normal tissues, you can through a minimally invasive approach reach the diseased area and take that diseased area out. And that is the beauty of navigation, that you don't have to take bigger incisions and cut the normal tissues also. You can just reach at the point which is desired. Fourth is high-end microscopes, 4D microscopes. So spine under a microscope, a thin nerve is seen like an elephant's feet, and that's why with microscopes there is a better illumination, better magnification, and your assistant surgeon can also see through his eyepiece and he can also actively help the surgeon in the surgery. Fifth is operating endoscopes. Now majority of our spine surgeries, they are through endoscopy. Gone are those days where bigger incisions, bigger cuts used to be there, and the magnification to the normal eye of an operating endoscope is to the tune of 25x, which is 25 times magnification which is there. Sixth important advancement is neuromonitoring. People used to be afraid initially, कि doctor, after my spine surgery will I be paralyzed? People still ask me this question every time I tell them that you need a spine surgery. But now, with the advancements in neuromonitoring techniques, what is neuromonitoring? So when a patient is undergoing surgery, there is a doctor who is constantly monitoring the spinal cord waves. And if God forbid any pressure comes on the spinal cord and alarm blinks up, the doctor immediately makes the operating surgeon aware that there is a pressure on this part of the spinal cord, that is taken off and a disastrous complication is avoided. So neuromonitoring is one very helpful tool which has helped patients recover faster and avoid disastrous complication, and it is an intraoperative monitoring. Next is the ultrasonic bone scalpel. So when we operate spine, there has to be a part of bony burying which happens. So we have piezoelectric spine surgery or ultrasonic bone scalpels, which gives us accuracy in cutting the part of bone which is desired rather than cutting the normal thing, and exact dimensions of cut. It is like carpentry. You have to have a finest carpenter in order to achieve a good spine surgery. So these ultrasonic bone scalpels, they give us this precision. And last is 3D models. If I'm operating a bent spine, if I am operating a crooked spine, if I am operating a fractured spine, infected spine, tumor in the spine, I can get the exact 3D printed model of that spine, diseased spine in my hand one night before the surgery, so that I can study these 3D printed models and execute a surgery so that I am more familiar with the diseased spine. So friends, in this today's modern era, there are a lot of technological advancements which have happened in spine surgery, and this has helped the surgeons to give better outcomes of spinal surgery. Thank you.